And we are continuing our conversations here at the Tallinn's Creative Hub. And the next guest is Hal Wolf. You represent an organization called HIMSS. What is your organization, a group?
Well, HIMSS is a global nonprofit organization which has its roots in health information management, and the Systems Society is the full name. And we work globally to help with the improvement of care and health through information and technology. So that means we convene and work in events like this. We work at government relations, we work with both systems, hospitals, provider communities, and to find a way to bring technology forward and the information it creates in order to improve the development of care.
Would you can take more global view? We've been talking mostly about European kind of efforts and attempts to move to the e-health society, but globally, how is the world doing overall?
Yeah, it's an interesting time and a great question. We live in an extremely fast-paced and innovative moment in healthcare. Globally, we all have roughly the same challenges. We have an aging population, the silver tsunami, which is coming on top of us. We have people living longer than they ever have before and dealing with chronic diseases that are a part of that. We have challenging funding models. Our funding models today are holding water, if you would, but we have even more challenges coming up as we have an aging population and fewer people to contribute towards taxes versus the number of dependents that will use our healthcare systems. And we've had a lack of actionable information that providers need and consumers need and patients need in order to find the best treatment and care and the opportunities. So there are other components of those challenges, but literally everyone, and this is what's fantastic, they're all looking at the same challenges. And so when you come to a conference like we have here in Tallinn, you hear this amazing exchange of ideas and information, committees being formed to actually take actionable efforts moving forward. It's exciting.
What happens in this field in America? I think our viewers are already recognizing your American accent, so you can tell about your home country.
Yeah. Well, I think in the United States, we're also in a tremendous opportunity to take advantage of the infrastructure and the technology and the EMRs, as an example, that have been put in place through meaningful use, which was a significant investment on the part of the government. And we're looking at ways to take the rules around meaningful use, which means the expectations of how providers and hospitals will utilize the technology and the information so that it's used in the care delivery and understanding clinical decision support and understanding how often we need to be in front of patients and how information technology can be used to support care delivery. So we're looking at a different set of rules that are coming up that are going to support the delivery of care on a more unified basis across the United States.
But many issues, of course, have to be solved. When in Estonia, we talk about the ID card, that is one of the basics. In America, I lived 25 years in the States, so
yes.
I know the system quite well.
Yes.
In America, I think it will never happen that there will be a national ID card. We have the social security numbers there, but so what are the building blocks of the e-health society in the States?
Yeah, well, so you've had the experience in the American system, and I'll actually push back and say we probably don't have a system, especially in comparison to other countries globally. And I think that's something that we've been trying to work towards. But if you get back to what the foundations in the American system do work in the health environment, as you know, we're very consumer driven.
Absolutely.
So you see the health model, which is the applications and the expectations of the consumer and the investment in that, it is quite large. And so what's critical for us, and we're doing at HIMSS, is we support the interoperability through ensuring that there's standardization about how these applications can speak to each other. We work with the government to ensure interoperability with vendors and organizations across the country, because we know that the acceleration on the health model is critical to match it to the medical model, what's happening at the hospital, what's happening inside the clinic. These two worlds are colliding, and they're joining together. You can make it a collision, which is a rough force hitting each other, where you can make it more of a smooth transition. And we're working in the States to try and make it a smooth transition.
I think many Americans know that America has probably one of the best healthcare systems in the world. The tops of American system, the hospitals, the research universities, they are just the best in the world. But for many people, this excellent healthcare is not still accessible. Many people have kind of idea that healthcare, quality healthcare is very expensive. There are government initiatives, as you know, there are Obama era initiatives, the Trump era initiatives. There are lots of kind of gray zone in American healthcare. So
No, you're absolutely right.
How do you try to clarify that for people and bring them into this
Yeah.
more clearer new age with e-health?
Well, you hit the nail on the head. It's about access, which is true, but it's about affordable access.
Yes.
And I think the tightrope that we're trying to walk, but what is clear to differentiate, is there's a difference between having insurance coverage, but what that insurance coverage pays for in terms of the access to care. And that's a debate that is being highlighted right now and challenged across the front page of our newspapers.
Yes.
And I think, quite frankly, it'll be a discussion that'll be going on for the next couple years and will be the high point of some elections coming up. But,
So, yeah.
No, please.
So when the European Commissioner on Healthcare was asked how the United States and Europe are cooperating on the e-health field, he didn't really answer us.
Yeah.
Is there a cooperation?
There is. There's a the cooperation going on in a number of areas. So first of all, for several years, there has been a joint commission between the United States and the EU, as an example, on interoperability standards. It's very important for us to be able to exchange data in de-identified, aggregated ways just on research. Secondly, because of device manufacturing application capabilities, whether at an industry level or on a personal level, again, interoperability helps commerce. And it also helps the patients and the consumers and the citizens. And by the way, each of us wear all three hats simultaneously. We'll walk in with something wrong. We'll have, as a citizen, an expectation of what our governments are doing to support us. And then as a consumer, we wanted everything yesterday and wondering why we had to walk in the door in the first place. But we're working on a joint basis and having those conversations. And then we sponsor large conferences globally. Our largest one takes place in the United States, but it truly is a global conference, which is HIMSS 18, which this year will actually be in Las Vegas. About 45,000 people will come, many from across the globe, to sit with each other, talk about these issues, and talk about how we can support each other from different points of view. There's many things the American healthcare system can learn from their European counterparts, and there are some things, hopefully, that Europeans can learn what the Americans have gone through as well.
Absolutely. And we thank you for coming to Tallinn and bringing your knowledge and expertise to our conference here.
Absolutely. It's been an honor to be here.